Recording in progress.
Welcome to today's webinar with eLotus, the foremost provider of acupuncture continuing education. I'm Donna Chow, your host and your moderator for the session. We take pride in hosting continuing education seminars for over 2 decades, and today's class is going to be a special treat for you. Why, you ask? We have the honor of featuring one of the country's top Chinese acupuncturists who has over 50 years of clinical experience and is over 80 years old. He has studied under several masters in China from the end of the Cultural Revolution until the 1990s. At his semi-retired state, he is still seeing patients, but more eager to impart this extensive knowledge on achieving optimal acupuncture results with all of you. He feels the need to pass down his knowledge to the next generation of acupuncturists. Prepare to learn from one of the most experienced and skilled practitioners in the field. And thank you for joining us for this special opportunity. Today's session is sponsored by Evergreen Herbs and is the third or the last of his 3 classes, Ashi Points for arthritis and joint pain. Master lessons of over 50 years presented by Dr. Kai-Fong Dao. Class will run from 9 a.m. to 1 p.m. Pacific time, and we will have a break in between. Before we begin, let's ensure that we are all set up for an engaging and informative session. For the chat room, please set your chat preference to everyone so that all attendees can see your messages and join the conversation. If you have any questions for the instructor, please type them into the Q&A box. After the session, a quiz will be available the following working day, and we will send an email notification once it's ready. Please do note that Dr. Dao will be speaking in Chinese, and a translator will be providing consecutive interpretation in English. This setup is similar to studying at a TCM hospital in China, where you can observe everything the teacher does in the clinic with the aid of a translator. We kindly ask for your patience as Dr. Dao speaks slowly and has difficulty hearing due to his age. We'll have a Q&A session throughout the class, so feel free to ask any questions. There are no silly questions. We're all working towards becoming better practitioners, and I'm very excited and hope you are too. Let's begin this unparalleled learning experience.
Good morning, everyone. How are you today? Can you guys type into the chat room for me if you can hear me okay? Please type okay. Good. Okay, wonderful. So like Donna says, this is our 3rd class Dr. Dao is having and with us and sharing his clinical experience, and I'm excited. Well, sorry. Okay. Yeah, technology is, for somebody 80 is a little different than technology for a 10-year-old. And I feel like 82 because of all the AI stuff that's going around now. I feel like, wow, how am I ever going to catch up to this? It's moving so fast. Here, Sam, please. Can you turn it off? Thank you. Maybe he's a patient. Okay, anyway, sorry about that. Now, so today's class, I'm just going to do a little bit of intro because I think most of you have already been to his previous 2 classes. And I have put down like the key points of his Ashi needling, the important points that you should know. already very, self-explanatory in the notes. So even if I don't go over it in detail, you will get the gist of it just by reading. And if you want to know more, you can always go back to his first class where I elaborated a little bit more. But the importance of today's lecture is the demo portion, where we actually see how does he do the Ashi needling. Because in school, you think that Ashi needling is so easy, right? Wherever the patient says there's pain, you just needle there. And that's what I thought too. But it's a lot more extensive than that, because it involves how to find the Ashi point, how to hold the Ashi point, and how to get the de qi sensation. And all of that you will see today as we go over how to treat for patients with different types of joint pain. Okay, so let me briefly go over the key points, and then we'll get started with the demo. Okay. So we're gonna go over, like I was telling you, the key points first, and then we're gonna do demo, and then from there the Q&A, and then also if Dr. Diao has any advice today for new practitioners. So there's so many different styles of acupuncture. Dr. Diao has also studied with many different teachers in China. And finally, at the end, he tells me that the best method that he finds that is the simplest and most effective is Ashi needling. And that's what he has been practicing, and that's what he wants to share with you today, because he feels like everything that he has learned should not just, go to the grave with him. And because he doesn't have any disciple studying next to him in his clinic, so he feels this is a good opportunity to share what he has learned and pass the baton down to you guys. So learning from a Chinese sifu is a little bit different than learning from an English speaking. Usually when you're, learning from an English speaking teacher, you go to a seminar, you pay your tuition, and then they'll teach you whatever it is. But from a Chinese teacher is a little bit different. Usually when you approach them cold turkey like that, there's no Chinese teacher who will just take you as a disciple. They want to decide if you're qualified to be their student, and also you have the proper ethics and also morals to be a good practitioner. And then they will decide whether or not they'll teach you after they take you under their wings. So it's a little bit different. There's a lot more expectation from this kind of teacher-disciple relationship that the Chinese culture, the teachers expect. But in this setting, we have done all that for you. We have already communicated with the teacher, and then so the expectations are a little bit different because this is not in a clinical setting. So, and then he also understands that what we want is for him to share all his knowledge. And he does actually very bluntly, as I will explain in a little bit with some of the answers to previous class questions. He sort of doesn't cover anything up and gives you the smoke and mirror answer. He will just tell you as is, because he's a very straightforward person. And we like working with that, because sometimes teachers who are very elusive are very hard to learn from, spend hours and hours and you still don't know what they're talking about. But that's not Dr. Diao, thank God. So here's his experience, this slide. The next one, okay, so let's get right into it. These are some key steps. So if you are new to today's class, you didn't come to the previous two, just kind of have this in the back of your mind. So when you're watching him do the needling, you will remember these tips. I will also mention it too when we're doing the needling, just as a reminder for you, okay? So number one, always he does is ask the patient to identify the most painful point or area with a finger. Sometimes patients will say, oh, I have pain here. He'll tell them, okay, use one finger to identify the most painful point. Some patients can, some patients cannot. So you just have to try to tell them to, at least narrow down the area for you. Because what you're trying to do is, number two, palpate for that hardness or that cord. Whatever it is, under the skin that you're feeling that is abnormal compared to other parts is the part that you need to pay attention to. Usually it's like he says, it is like a knot. And he also mentioned that it's very important. The needling hand usually is the right hand, right? If you're right-handed, the left hand is the assistant hand. But he says the left hand is more important than the right hand, because that is the hand in which you're going to feel the knot, and then you're going to hold that point or that knot. So that's number three. Number four, hold on to the knot with your left hand. Basically, you're making it steady. Don't let it move. And then you needle with your right hand, number four. So that's where the art is. I feel like the hard part of Ashi needling, number one, is finding where that knot is, because he has asked me to feel his patients when I'm in his clinic, and many times I don't feel any difference. So that's one, that's difficult. Two is the needling part. At which angle do you needle? Which depth do you needle? How do you know you have gotten the dirty sensation and the patient feels like, that sensation of numbness and then, tingling or whatever it is that we're looking for, that acupuncture sensation. So to let you know that, yes, it's working. So those, I think, are the two most difficult. Okay. So right here, I asked him before, so what if you cannot find that knot, then what happens? Then he says, start with wherever the patient is pointing. If you cannot find any knots there, basically expand the area you're searching until you find it. There has to be one. It's impossible that there isn't any. It's probably your finger is not as sensitive, but there is definitely going to be something that you have to find. If you still cannot find anything, you will start needling wherever the patient says it's most painful. Okay. Next, the needling hand is not as important as the other hand, the stabilizing hand. So especially if you're needling onto a tendon, he says, because the tendon tends to be very slippery. So you need to hold it and stabilize it so that your needle is going exactly where you want it to go, not to the side of the tendon, but on the tendon itself. Next, the gauge of needle he uses is number 30 because he wants to elicit a very strong stimulation. Usually the stronger the stimulation, the more effective the treatment. So we're looking for that soreness and distended feeling. Number 4, he wears gloves when he's palpating and when he's needling, because I've seen many times when he extracts the needle, there's some blood that will come out. And then he says that's also a good thing because, the tension is being released. Number 5, use as many needles as you need to relieve the hardness and the pain. So there's no, ego thing here going on where he says, I just need one needle to treat the patient, no such thing. Use as many as you need because the area of pain may be a big area. Number 6, so what he does is he works on the most painful area first. And then when he takes out the needle, he'll ask the patient how they feel. If they still have pain, he will then work on them again, finding a secondary area next to it, wherever there is problem. Then he will continue with that until the patient is completely pain-free, then to let them go. Next one is when the dirty sensation or the sensation of the soreness, the patient feels that when you're needling, you want to needle, suppose this is the knot, right? So you want to needle through the knot and then break up the knot. Okay, so he'll demo this. It's kind of hard to explain in words, but if you see it, you'll know what I mean, how he manipulates the needle to try to break up the knots. But the idea is you don't just touch the knot, you need to penetrate the knot. Okay, next one, for the patients who are very sensitive to needling and very sensitive to pain, what you want to do is you want to do cupping first. So ask him, why do you do that? How does that make it less painful? Because the patient is still very sensitive to pain. And he says, with the cupping, you desensitize the area. And they already, there's a lot of pressure and then it's being worked on. So then the body sort of knows and prepares itself for what's coming. So it's just kind of like a warm-up, if you will. So then the patient won't be, as jumpy when you just stick a needle in. Okay, and then number 10 is when I was talking about earlier that he's very straightforward, because I asked him, oh, your patients can leave after 5 minutes, basically after the needling session, when he feels the dirty sensation and he pulls it out and he'll just tell the patient, okay, you're ready to go, Sometimes that whole needling section of the treatment is maybe 5 minutes, but looking for the Ashi point maybe 20 minutes, so the whole treatment could be as long as 40 minutes or as short as like 10 minutes for him. But the idea is that you don't need to leave the needles in to let the patient rest in the bed, because once you have broken up the knot, that is enough. The treatment effect is achieved. And so I asked him, well, so can you still let the patient rest with the needle in? Will that make the treatment like worse or something? And he says, no, it's just like I put down in the notes here. He said they can rest. It's always good if they fall asleep, and they will feel much more refreshed when they wake up. But also some patients, they want that because they'll feel like they're getting their money's worth. They feel like, hey, why you only needle me for 5 minutes and then I pay $100, they don't feel like they're getting their money's worth. So that's another psychological thing when he will let them go and sleep for an hour or something like that. Okay, number 11. Okay, this method is a little bit different than the regular acupuncture, where most acupuncture, if you needle the patient, they'll get relief. And then when they go home, the effect will slowly wean off. Maybe the pain will come back the next day, but not as much, but it will come back. But his method is after he needles you, you will feel more pain. Sometimes when you go home, you'll feel like, wow, the condition is getting worse, but really it's not. So what happened is you need to tell the patient, don't worry, next 24 hours, you might feel more pain, but after that, the pain will gradually improve and then it will be gone. Don't need to come back. Whereas the regular acupuncture, many times is you get the relief first, but then the pain comes back. I feel like Dr. Dell's needling technique is the very traditional Chinese style. Because the very traditional Chinese style is usually, like the toina, it's very aggressive, very, very painful. Not like the Japanese kind of style, very soft and gentle with very thin needles. You will see as he demonstrates. Okay, contraindications. Number 1, during pregnancy, you want to not needle the patient. Definitely no needling 8 months plus. And then also the thoracic points. Pneumothorax could happen very easily. So he advised the new practitioners to not do that. You need certain practice and certain experience, enough experience to do the points. He did demo that, I think, in the first class, just to show you how it's done. But he doesn't recommend you to do it if you have never done it. But then the catch is, well, if you have never done it and if you don't practice, how are you ever going to do it, right? So I guess the answer is you need to practice safely, study the anatomy carefully, and then practice on people that I guess are your family or friends first, and practice gently so that you can be more aware of how the tissues feel and what you're supposed to do. And then watch this video again, because he gave, I think the first class, very good pointers on how to needle the thoracic points. Okay, next one. Another tip, when there's no obvious pain or not, then you do the bloodletting first. So do the bloodletting, do the cupping, and then you look for the Ashi area, because when you let the blood out, the subcutaneous tissue will rearrange a bit. So sometimes the knot will come out. Then all will be more obvious then. And then again, please use disposable cups and wear gloves. And another tip here is, he said that the more severe the pain, the more holes you can puncture when you're bloodletting. He will show you the pen that he uses and the disposable needle. Those diabetic needles. He usually does he pokes 3 or 5 holes for each suction cup, but when the pain is severe, you can do as many as 10 for each suction cup. So the idea is to suck more blood out. Okay. And then he also says when the case is severe, you want to do the cupping and the needling first, and then, find the right spot to needle. Somebody asked this question in the first class, so I put it in the lecture notes. So after, they asked, can you shower? Because some teachers taught before that you shouldn't shower after you do maksa and do cupping. But he says, it's okay. It's not an absolute no after you cup, but it's better not to for 12 hours. And then also, you don't need to put any ointment on the holes where you bled. The body will heal itself. So on the areas where you cannot needle, he would like you to do bloodletting. So today we might see that because we're working on joints, smaller joints. The first class was on the neck, second class was on the back. Today we're working on different joints. And also, Gao Huang is somewhere you don't want to be, needling. That's the thoracic area. Now, another contraindication are for these patients, diabetic patients and patients who are on blood thinners. He says it's not an absolute no. If you have to, you have to, but just make sure you don't bleed too much because, you know, they will bleed too much. Okay, so that's all on the tips. And before we go into the demo session, I want to ask you guys one question. Now, if you have to needle the joints, the fingers and the toes, or the hands and the feet, you know it's very sensitive, right? So how do you guys do that so that the patient doesn't feel that much pain? Can you type in the chat room, what are your experiences? How do you needle the fingers and the toes, hands and feet? Can I see real quick what you guys do? And then I'll tell you what Dr. Dell does. Hang on. Okay, some people say they use very small needles. 我在问他们啊，这个手跟脚啊，我在问他们手跟脚在扎的时候，他们有什么办法让它不要那么痛？有一些人说用小针，有一些人用说比较 tiny needles, squeeze, stimulate the area first, pinch another area of the body. 有的人是说用比较小的针，细的针。有的人说先在按摩这边，让他不要想到你在扎这里手。有的人说就是先按摩，然后有的人叫病人先深呼吸这样子，所以也不错，挺好。
都也可以啊，可以。可以，都可以。
Okay. So he says, yeah, you guys are very good. The suggestions you put down are all good, he said. But what he does is he, like some of you, massages the area. He says, whatever point you want to try to needle, to desensitize it first, just by massaging it, you know, so the patient get used to it. It's kind of like you're marinating the area, getting it ready. So then the patient won't feel as much pain. And the next question I ask him is, okay, for joint pain, now, is it the bone that is painful or is it the soft tissue? And then he said, almost always, all the joint pain patients, actually the pain is in the soft tissue, the ligaments or the tendons. It's never the bone that actually has the pain, very, very rare. However, you will see bone problems leading to soft tissue around the bone or around the joint that have pain, but it's never really the bone. So that's one key. So then that's why you do the bloodletting. You're treating the soft tissue. Okay, so let's take a short break. We'll do a 5 minutes quick break, and then we'll set up the treatment demo session, and we'll come back with the first patient. All right, thank you very much. 好了，我们
Testing, testing. Testing, testing. Can you guys hear me? Testing, testing. We good?
Yes. Okay, so today's first patient has thumb pain. So he's gonna explain to us what the problem is. 要讲中文还是讲英文都可以。OK，中文 OK。哪里痛？哪里痛？
哦，我这个手呢，这个大拇指
To
头，
hold the microphone so he can point.
这个大拇指头呢
So the thumb
痛。
pain right there where he's pointing.
其实
Can you pull in the camera a little bit? 他要看精准一点。最痛是这里
这一
，right
块
there, the whole piece, the pain.
这个症状有10几年
It's
了，
been 10 years,
嗯
10 years plus.
就说有的时候好，有的时候呢
Sometimes it hurts,
不好，这样。
sometimes it doesn't hurt.
有没安啊？和正确。
其实西医我也看过，中医推拿我也看过，
So
看过了， 好一
sometimes
点
it
点。
doesn't hurt, sometimes it's been 10 years. And he's seen Western medicine doctors and Chinese medicine doctors. Every time he sees them, it improves. But then the pain comes back.
所以变成就是说，有的时候就很好，有的时候呢就觉得不好，就是这样。那我就自己按摩，
So it's off and on the pain. He will massage himself.
我自己就看着 YouTube 上面
So he'll
医
watch
生说怎么
YouTube
按穴道，我就看着
YouTube
按，
suggested acupuncture
可是
points.
也有效。
So he said it's
我一按
effective
不
too.
痛了，
You know, when he presses on the
可是过一
pressure
阵子
points,
又来
then
了。
you know, he'll have pain relief, but then it'll come back, the pain.
不是这里痛，这里痛啊。
So where is it
在这里边。
exactly?
Okay,
so-
一般是腱鞘炎是这里痛，
Usually the pain is here,
这
不
边痛
是这个。
but the patient,
这个是这边疼，
对，
关节疼，
so it's actually the
Right.
joint that has pain.
关节疼。懂了，这个
So-
疼，
对，
这个疼，
So
Right.
pain there, yes.
这个
Painful
你看，如果
yes.
这边痛，对，
这个
Pain is
很
also
硬的，
painful.
哎，
这个有个结在这边，
There's a knot there. He's feeling a knot.
很硬。你看那个结，
写一下，这里the knot.
真的是关节炎。这个疼，
So
有一点，这边
is it
是
painful here? He
Check
says a little bit. How about over here?
这个
How about here? 不疼。
这
现在这个
No, he says no.
这个
How about here?
应
No.
该痛是
这
So he's
这里
here.
啊，
The pain is here,
这关节里
right at
面
the inside of the joint.
这个
而且中间对两个骨头的中间。
Yeah, at 灵骨。
不是这里疼，这里疼，这里也疼。
对，这边也会痛，
They on that side also hurts. 这里也痛。
这里也疼。
How about here? 这里痛吗？
这还好，
It's okay.
这个
对，这边也会有一点，
A little bit here.
肿了，它是肿，
He
已
Dr.
经
Young,
硬化了很久了。
he said the hand looks
对
swollen
啊，所以说很久了，
and
这
everything
个
has
韧
hardened.
带
The tendon,
硬化了，
the tendon has hardened.
这里也疼。
硬化是就是说摸起来很硬，那样就对了，跟其
对啊
他人的比起来。
不是有个结在这边，
嗯
你摸一下还是
So he said there's a knot. See, I'm feeling
摸到
nothing.
吗？摸到吗？
I just feel a tendon.
这个
对
No.
这边
I don't feel. Oh, you
啊，有
a
一个
little
结
bit.
在那边，有个结啊。
I don't know if I'm feeling it right, but because I feel on myself too. So okay, if you're a
Yeah,
beginner,
yeah.
usually in the beginning you won't feel anything. It's like me trying to learn pulse diagnosis with Dr. Chang in
啊，
the
有个
beginning.
结这边啊。
I
对
just
啊
can't feel any of the pulses.
对啊。
As you feel more, you can.
这里也这里
对，一块了。
Grace be with him a little longer so she could feel the knot more.
那个到这里， 这个是最硬的，这个这里有点疼，这个如果结
So there's a
Oh, wow.
knot there.
刚才好像是哪边？
啊，这个
The patient says there's a little
不
bit
是
of
这里
pain
的，
somewhere around here.
不是这个，现在弯几下没那么疼，这个痛吗？
一点点。
A little bit of pain
那
only
里这
here.
里，
How about here? 这里呢
嗯，
No.
这里有
How about
对，有一
here?
点。
A little bit.
有一
可能
点，
刚才按那个痛按一按，它这个痛就没有了。
都要弯几下就没
The
了。
patient
睡
says,
好，
yeah,
仰着睡，
oh, with all the pressing, the pain is relieved.
痒的。
仰着头这边，头仰着仰，
嗯，
哎，对对，哎，对呀，这样子，
要不要再高一点？
可以。
可以可以，你舒服就好了，你睡好舒服。痛吗？
对
啊，
对
这个有，
对，
Yes, there's pain there.
过去一点，哎，好好，这个疼，你等一下，这个疼吗
会
啊，
有一点。对，
Yes, there's a little bit of pain.
这个它太低了，不是，等一下，给我张凳子，
凳子 Oh,
没那么累。这个这个
thumb pain.
这个有个结
先扎远端吗？
啊，
先扎远端，不是扎这个地方。
先扎这里，
为什么呢？
这个颈头肌就下来了，影响到这个，这样子下来。
So Grace asked, do we needle the elbow
Yeah,
first and then the
just-
thumb? And why? And then Dr. Dell says, because it's coming from
这
the
里肿啊，
elbow.
这里疼，
every
有
it's
时
swollen
候
also up there and painful
其实
too.
扎这里很有效。
He says sometimes just needling there is enough in the elbow area.
酸胀吗？
酸胀吗？
酸。
Also, the patient feels sore.
干嘛？
Do you feel
干
distended?
嘛？
胀吗 means do you feel
这
distended?
个
哎呀，
有 yes.
胀吗？
Distended?
哎，胀
有
Yes.
胀，
有。
这个胀
How about this needle? No.
胀，
How about
这
now?
个胀，
有一点点。
A little bit.
这个
呀，
Yes.
你可以动，你这个动可以随便动，
So he's asking
一
him
直
to move the thumb.
动这个，不是动这个，对对对对，对，一直动。哦，这个胀吗？
You feel
Zhang.
distended?
哦，
Yes.
这个脏，这个脏，脏啊，
没有，
No, he doesn't feel distended.
动动，你摸一下，现在没那么肿，
So it's not as swollen now.
这个
软了，
啊，
软。
So
The-
the
ah,
knot feels
yeah,
softer
don't.
now.
这里
对啊，动动可以动，
So
一
move
直
it
动，
around, please.
啊，没那么肿啊，
So it's not as swollen and it's not as tight.
很多这个腱鞘炎的，跟那个扳机指的很多，
Mm-hmm. He said
经常碰到了，临床上经常碰，以前很难处理的，
很难处理啊，
很不容易好的。
很不容易好。
对啊，你要么是打封闭，打封闭有时好了一阵子，到时候又回来了。那个在国内啊，它最有效还是小针刀，
小针刀。
小
Oh my
针刀
God.
效果也不错，但是很痛啊。
So he said there are a lot of trigger finger and tendonitis patients, with Western medicine, they usually give you a steroid shot, but the pain will come back. And he
这
said the most effective Chinese medicine treatment is with 小针刀, which is the little, have you guys heard of this method? It's using like a little scalpel, that kind of like a little knife, and they go under the skin and they scrape the tendons.
动
I'll put it in the chat box so you can look it up.
这个
And see some demos online. It looks very painful. I don't know if people in this country can
这样
tolerate
Come on.
that.
不会，
Okay, so
这个
distended? No.
嗯
He
这个
feels okay.
没有，
No,
现在没那么
no distension feeling.
有一点，
A little bit. So just in that spot, we put down 5 needles.
现在轻松一点啊，没那么
So he's asking the patient
没
how
那
the
么
thumb
硬
feels.
啊。
现在觉得怎么样？
还 OK。
大拇指还 OK，有
嗯
比刚才好一点吗？
这个我
你觉得
不晓得怎么比较，因为之前
嗯，
我可能也习惯了，所以就没有什么感觉。
没
Okay.
那么没那么近。
So he said, he's used to the pain. He doesn't really feel that much difference compared to before needling the elbow.
扎这个硬结，有时候有些这里也有，有时候这里也有，这里也有。现在他这里还好，没什么。
Sometimes you
四
need to
个点
needle all
假
the
如有
different
痛
areas
有
of
硬
the
结都要
elbow.
扎。
So if you find any knots around the elbow, you need to needle all of them, but he didn't find them. So
扎这
only
里
here.
效果很不错了，很多很多的这个。
这个针是30 gauge 的嘛？
这个是32了，好像。
Yeah, this one is 32. The
好，
distended
动一
feeling,
下。
Donna, what is a distended feeling? It's like the 得气 sensation when you feel.
有松很多了。
How would
有
you
松了
elaborate on the feeling of distended feeling that he's asking the patient feels? Is there any other words that you would say?
Achy, heaviness.
Achiness,
这
heaviness,
个结扎这个
distended feeling, the
It's like a
feeling
deep-
of
It's a
when the acupuncture needle hits the right point. I don't know what kind of feel. How do
kind
you?
of like you have a deep itch and then the acupuncture needle scratches it for you because you can't get to it any other way.
扎这个结，
Okay, so we're gonna needle the knot now. It's actually gauge
这个
34.
比较痛。
Yeah, here, this point would be painful. 1.5 寸.
胀吗？
没有
1.5 寸needle.
这
No
个
distension feeling.
，Yeah，有，
胀，
Yes, he feels
这
it
个
now.
胀，
正中那个结吗？
这在扎在中在
扎在结上面
扎在
You-
结上面。
You notice his middle finger is holding on to the tendon? That's what I mean when I was explaining in the beginning that the assistant hand is important or more important than the needling
Oh.
hand.
这样
So
胀
he's asking,
胀
do
比
you
痛
feel
多。
distended or do you feel painful? The patient says distended. So now you don't want to feel pain because in his last few classes, when you feel pain with the needle, you're hitting a vessel or hitting a nerve. We're not looking for the painful sensation. We're looking for the feeling of that distendedness, soreness. Is there any other adjectives that you guys would use that could describe this dirty sensation? If you can help me put it in the
Don't.
chat room.
没有，
没有，这来
没有
啊，
Okay, patient feels it
胀
now.
吗？
，Yeah，
这个胀
第二针是在那个
也是这个
结
结上
上
啊，
面
不是，还是中，
在结正中间结
对
上面，
还在结上面。
So the second needle is on the knot too. It's not on the side of the knot. It's still the knot.
这样算不算是围刺？把它都算是围刺吗？
嗯，
就算就是现在再加一针在那个
对，
结
周围
上面
周围都有，周围都要扎。
So
Well,
he says,
它有个结的地方都要扎，
是在扎在结上面还是结的旁边？都要。
中间扎进去，旁边也要扎。
Okay, so he
痛
says
吗？啊，它不痛啊，
needle on the knot as well
Zhang,
as
oh, zhang.
around the knot.
胀
有，
Yeah,
zhang,
oh, this
胀胀，
this one the patient feels it
很酸
immediately.
啊，到
Yeah.
底了。
Heaviness, achiness, pressure. Yes, thank you very
扎
much,
骨
guys.
头没关系的，
So it's okay
因
if
为
you hit the
它
bone. No
很
problem.
深强的，它有些比较。 有些浅浅的，有些中强的，有些底层的、上层，那个，对，它一直下去。这个呢，
So sometimes you're needling the
这个
shallow
那个关节
level,
里面，
sometimes the mid level, sometimes the deep level. This one is the deep level. Okay, so we're gonna needle into the joint for this one.
知道吗？
没有，
这个没有，这个
How about now?
没有，
No, no
这个
feeling.
没有，这个，
没有，
No.
这个太热了，太热了。
Oh, look. Can you guys see? The knot is
太
so
热了。
knot is so hard that the needle is bent.
它是关节里面，这个有啊，这个有吗？
Just 1 foot.
呃，
Hold it with 1 foot. It's a
这个
lot easier.
没有，
还是没有
呀，有，
啊？
To try.
没有，
有，
Hold 1 foot.
这里有了，
胀，
Yeah,
太
see,
热
see?
了，热热，
硬了，硬
不是再容易粗一点的。
粗一点好。
Okay, he says, get out my big guns. The 30 gauge, please.姚医师，这里扎那么多针，是不是因为我们用的是34寸的？如果用
这里也有
30
结啊，
不
也
是，
有个
我是说，如果是用30的针比较粗的，是不是不用扎这么多针，这么多根？
啊，
如果是用30比较粗的针，需要扎这么多支吗？
它
还是也需要
它反正还有酸，你就再扎嘛，没关
OK
系的，多扎几针。
？I asked him if we're using gauge 30 instead of 34, do we need to still use that many
那
needles?
这还是肿啊，你看，
And then he says,
2、3， 这个
You need to use as
这
many
个还是
needles
总还
as
是
you
硬，
need
你是
to
可以
fill the
扎。
knot. And also, if you feel the area is still swollen like it is now, you still need to put in more needles.
有吗？胀吗？
Yeah，
Yes. Yes.
有没有？
刚才那一下有，
刚才有，现在没有。这个，
没有，
嗯，再来这个，
没有。
再下去。啊，没有，可以。
So we were using 34 gauge, guys. Now we're using 30.
这太弱了，这个32啊，
是34，这个
34，
是粗一点，这是30。
这个是30，
Okay, so this is
32，
吗？这个是30哦。Yeah, it's
这个
30.
32也还可以。我一般用的是30，这个还是疼。
It's we're using 30 gauge and 2 寸 now.
这个32，到吗？
没有，
再来，
Distended? No, no.
没有就找，没有，有吗？
Yeah, he's
Yeah,
going
yeah,
pretty
you
deep because he's going into the
这个
joint.
这个有吗？
有，
这个有。对啊，这是
Yeah, it's very
在
hard.
关节里面的。
So he's gonna get into the joint.
这个再走。这个有。
有。
哦，
How
这
about
个
this
有。
one? Yes, he says yes.
哦，这个扎下去的，它是阻力的，这它你扎不进去的。
Oh, okay. He says the body has resistance. When you're trying to push the needle in, the body is resisting the
有
needle.
酸胀就有效了。其实这个手啊，
嗯
今天它不错，这个木头不错，这个所有的腱鞘炎的，这里腱鞘炎，它不是腱鞘炎，
Yeah, usually it's tendonitis on the
这
wrist.
个很多的。
He says, do you see a lot of that? But his case is not that. And it's not trigger finger either.
这个很多，这个腱鞘炎的也很多。
Oh, tendonitis at the base of the thumb is also
弹手
oftenly
指的，
seen.
弹手指伸不直。
Yeah, you cannot lift the thumb.
这个也很多
Or，in the middle finger. There's a
这
lot
个
of
也
that
很
too.
多。你看啊，今天它很有代表性，很有代表性。这个临床上碰的很多这个3个问题的人。
Yeah. So again, to repeat, we see a lot of here, problem tendonitis here, and at the base of the thumb, and also the middle finger here.
对对，很
That's the
多。
most commonly seen. To have pain here on the thumb
其实
is
它
not
这个
as
呢，
often.
它是关节韧带问题，这个也很多，也多。
So
但
his
是呢是
problem
不
is in the
同的，
tendon inside the deep joint.
不同的。一般来讲呢，都要找这块看看这里有没有，这里有没有，这里有没有，有酸胀的都要扎。
所以
这扎这个啊，对，
所有这些问题都是要找这4点。
先扎打这范围打大一点嘛。
Okay, so he says for any of the tendonitis you are addressing, either on the wrist, on the base of the thumb, on the third finger, you always want to look for these 4 areas where the first area is where the needles are, second is here, third is here. 哎，可以画在你上面吗？不好意思啊。
那可以。
1、2、3、4. So this is the 4th area.
反
So
正这些
look
有
for
的有性结的都要扎一扎。
look for knots at these 4 areas. If you find them, needle them. And then you needle them like this, 3 needles, 4 needles, 5 needles.
看看这里有没有，这里也很硬，
So see, did you see? Did you guys just see how he
有没有？
pull out the tube, but his thumb,
Huh?
his third finger is
没有
still on the
这个
tendon?
没有，
He doesn't lift up his assistant
有吗？
finger or assistant hand. It's always there to stabilize.
这个没有。
So Any distended feeling? The patient says no.
没有，
没有，
没有的话
没有
就拔出
没
来。
看是的，但是所有这个几个那个都是这样子扎了。
那通常要扎几次才会好呢？
通常啊，
嗯
1到3次。
1到3次哦。So I just asked him, how many times do we have to needle for trigger finger and tendonitis? He says 1 to 3 times. 那这种要放血吗？
有放血就更好了。
Oh, so he says if you do bloodletting, it'll work even better. 那如果要放血的话，要放哪里？
其实还是那个压痛点那边，扎针的地方。
Oh, okay. So I
这样
asked
吗？
him, where would
这
you
个痛，
bleed? And he said,
这
yeah,
个很痛。
where I'm needling.
扎留在这边呢，你可以再找看看还有没有肿的地方。有肿的地方还可以加针。
So he said, just wait a little bit and see if there's any more areas that are swollen. If you see more swollen area, then you can add a few more needles. 有一个学生问呢，刁医师，这个是有一个学生在问说，这个是慢性的嘛？
全部都慢性好几年了，
对，
大多数是
如果是急性的话，也是这样子扎吗
急性的也是这样子扎。
？Okay, so he just said that
胀。
you know this is a chronic case, right? For 10 years.
这个
And if it were an acute case,
这个
the
有
treatment is still the same.
这个那个很深啊，在里面。
嗯，
这个是慢性，很多人很久了，
刁医师，你有用那个灸吗？
就太慢，第一花时间，
Oh, he said Maxa takes too long
效果不好。
and the effect is not as good as needling.
我很少
So
用
he
灸的，
doesn't use Maxa very often.
可以灸，
You could,
可以灸，但是很慢，
but it takes a long time to see effect. So he didn't like to use it.
效果慢，
Yeah.
结果是最快的了。
He said this is the fastest Ashi needling. Yes, acute and chronic, same
给我
treatment.
手套。
所以刁医师，为什么急性跟慢性的治疗方法是一样的呢？
不也有一点分的。假如他急性的，
嗯
血很痛了，已经很痛，
嗯哼
那你是先放血，
嗯哼。
再扎针，没那么痛。
Okay, so he says that the acute case and the chronic case, the needling points are the same. However, if it's an acute case, he would bloodlet first and then needle.
那个慢性的就先扎了，先扎比较容易扎的对，先扎以后再放，再
So for chronic
再放一
cases,
点血进来。
you needle first, and if that achieves the effect, already good. If not, you want to see even better effect, then bleed. So I think that's what he's going to do
放
now.
血针
Yeah. 对，现在放。
都可以的，差不多有多久了？
大概10分钟吧。
可以，再来一针，
Or one more needle.
这里还是有肿。
He said it's still swollen.
你找啊，再找他。这个还是肿，这个肿。哦，这个还有，胀吗？
Distended? Yes.
这个呢还有，有，
Yes.
扎下去有阻力的，哎，
Yeah, there's a big
你看
resistance.
多深啊，很深，
It's very deep.
慢慢进，它都
So he's
Yeah.
needling slowly, but there's a lot of resistance, he says. So if you guys have any questions, type in the chat room. I'll ask him now. This is the best time to ask, you know, when
现在没那么，
you're in
现在没，
next to the doctor. I always have a lot of questions.
久了以后再按一下，是肿，他讲过
So
没那么
he's,
肿了，没那么
pressing-
酸痛了。
Pressing around the points and seeing if the tissue still
哦，这
feels
个
swollen
还
or
有
not.
还有
So
这
he's feeling still there's a knot. So he's going to add one more needle. He's needling into the knot on the Yuji side. He was needling into the joint on the Lingu side, on the yang side.
脏
So here he's needling into the knot.
没有，
No distended feeling.
这个
有
这
Yeah.
个脏
有
哦，这个
The
脏
patient jumped a
哦，
little bit. Yes, he feels it now.
可
The
以
patient
动
is tough.
可以
He
动
didn't even
动一
put
下
on one
还
time.
动不了。那很多这个弹手指啊，这个是动不了。
Yeah, yeah. Trigger finger, he's saying
他
that
说
many of them
这个
can't
他
move.
不是
So
弹手指，
this is not trigger finger. He can move it fine. 现在这样子，病人也不知道好不好。这针这么多针在里那里，他也
知道啊，
感觉得出来会痛不会痛吗
没那么痛啊，
哦
他比生快啊，
？Okay,
生快那个知道了，他知道。
I ask, since the patient has so many needles, how does he know if it's painful or not? And Dr. Dao said, oh, of course he will know because it will feel looser and more comfortable, the area. When he was needling the dorsal side, he wasn't targeting a knot. He was targeting the pain in the deep joint.
那放水这
我们有一个学生在问说：“爸爸，你的肺部有问题吗？就是
啊
呼吸系统有什么问题
呼
吗
吸啊，？”
呼吸系统，
还 OK 吧，我呼吸还 OK，没有问题。
那大肠呢？
基本都没有问题。
Yeah, he said he has no respiratory or large intestine issues. 有一个学生在问说，这个就是肺经跟大肠经嘛？那问他是不是有肺部的问题、大肠的问题？那病人说没有。Oh, hold on a second. Okay, so now we're gonna do bloodletting. Okay.
选这里。
So he pulled out the needles already, and then we're gonna bloodlet that same area. 就是刚刚扎的针的地方要放血，是吧？
对
Yeah,
放
we're gonna bleed where we needle. 好。
放
Okay, so this is how he does the bloodletting.
还好吗？还好哈。
So the disposable suction cup, I think it's you can buy from the Korean suppliers. So 廖医师, can you film him pulling out the needle? So when he's pulling out the needle, he's also stabilizing the area too. He doesn't just use one hand to pull out the needle. 这个在扎的时候，你在扎那个筋呐，哈，假如说这个是一条筋，那你扎的时候是把它扎透了吗？
对，一直有些要扎透的，有些不一定扎透的，反正扎到那边很硬了，再进去没有了就不用了。
再进去没有了是什么意思？
这已经扎穿了。
扎穿了
啊，对，
就不用再扎了。
对。
那哪个时候是要扎透，哪个时候是不用扎透？
通常都扎透还可以。
Okay, so somebody asked, do you penetrate the tendon? And he said, in some cases, you would just touch the tendon, but in most cases, you penetrate through the tendon. Does he not like to use glass cups? No, he just doesn't use that. I don't think he wants to do the sterilization. And I think he says that patient feels more comfortable using their own cup because he'll use these disposable cups and then he'll have the patient take it home and they can wash it themselves and bring it again next time. Where do you buy the bleeding device? I think you buy it at Walgreens. It's just a generic one of those, what do you call that? The diabetic needles. The knots could be at any depth, yes. Any shape we're looking for, rounded or not, more linear. It depends on the area of the body. Some knots they're all different shapes. Yeah, it's a lancet bloodletting device. Looks like this. 他们要看那个 close up. 这个在哪里买的嘞？刁医师
都有啊，网上都有。
你是 supply company 买还是去 Save On 那种地方？ Okay, he didn't get this from Save On. He got it from the supply company. Any of the supply companies would have it. Okay, pulling out the needle, still stabilizing with one hand to pull out the needle.
这里要吸一下吗？不要。这里要吸一下血。
啊，
不要再。
这个吸一下，这个很硬。
So Grace asked, "Do we need to bloodlet here?" And then he said, "Yes, it's very hard." So we didn't even have to use a lancet needle. The acupuncture needle did it. And then that's what he means by wearing glove, because when you pull out the needle, sometimes you'll have bleeding. How long does he leave the needles in? Okay, just like I was saying in the intro, he doesn't need to leave it in for half an hour. That's more for a psychological effect that, patient can rest and also feel like they're getting the treatment worth. But when he needles and he gets the feeling of the qi, or the feeling of, you notice every time he needles, he will tell the patient, ask the patient, do you feel the distension? Do you feel the achiness? He wants to make sure every needle works, it's not just needling into tofu. That's how it feels when you don't hit anything. And so when he does get the feeling that he's looking for, then he just leaves the needle just like that for 10 minutes only. When does he know it's the right time to take the bloodletting cups off? 就是这个杯子啊，要留多久？就是你要吸多少血出来才够？
出来就好了。
哦 ，OK。
现在你讲。
先讲 Chelsea, he said, as long as you get some blood out is enough. You don't need to look for a bunch.
扎针。
再扎针哦。
最后这一个部位很关键的。
Okay, here is the key. Okay, you guys. He's gonna needle again, and he said this is the key point to treatment.
那这现在扎完以后呢？
哦 ，OK。
再找。
OK, so 好，
再找的时候呢，很容易找出来。
好，等一下，先不要扎，我再讲一下。Okay, so here's the key. Okay, the Ashi needling. This is something that you probably don't do, is you think the treatment is over, but it's not. Now he's going to palpate again for the knot, and it's very, very easy to find the knot now. So I guess right now, the most stubborn knot is gonna manifest itself, and we're gonna needle it. 就是要扎了嘛，哈。So
可以啊，没关系。
He's feeling it with
那现在那个没那么肿了，这里还有一点点。
So he's feeling a little bit of knot, so we're going to add one needle. So do you see his middle finger? His middle finger feels where the knot is, and then he holds it, and then he needles. He never let go of that hand.
那这个有没有？
有感觉吗？
没啊。
Yeah, it feels a little bit. Yeah.
这个很深啊，到几乎到骨面。
It's very deep. That's a 2寸针哦。
1寸半呢。
1寸半 1.5寸。
那有就好了。那这个最小，其他都没有，这个还有个小的茧。就补一针。
He said there's only a small knot left.
那个效果就更好了。
Oh, so see, he just pulled it out. 就是补一针这样而已，也不用留针。就不用留针，就补一针这样打进去就行了。
不留就可以了。那个还是个小结在这边。
So he's needling whatever little knot is left, trying to get them all.
胀。
有人在问说啊，你摸到这个结啊，是不是那个血管肿起来？
不是在筋啊。
Yeah, no. Constance, he is not needling the subcutaneous blood clot. The knot he's referring to is on the tendons.
筋那个硬发了。那现在那个结很小了，还剩下一个小小的。
So there's a little bit here.
再补痛。
Yeah, this one.
胀吗
？The patient feels the distended feeling.
胀。
也会痛吗？
胀。
Yeah, it's distended, not painful.
胀。
So what is the definition of a trigger point? Can you guys tell me? Is a trigger point just a point that is painful, or is a trigger point a point that feels like a knot in the tendon? Because that is what he's looking for.
胀吗？
有
啊，
有，
Yes.
哎呀，胀，胀，流不流都无所谓。
Okay, so you don't have to retain the needle.
这还剩下一个，以前没那么大了，还剩下一点点。
So only a
我会
little bit
增
left, he says.
有吗？
没有，
这个
Yes, he said. Patient says
这
no.
个
No feeling.
没有，
No
Yeah.
feeling.
这个
没有，
这个，
没有，
哎，这个有啊？
Nothing. Nothing.
没有，
Nothing.
啊，
Nothing.
没有，
没有，
有吗？
没有，
哎，
Mayo. Nothing. He
Yeah.
doesn't feel it.
没有，
Nothing. Wow.
没有，
Wow. He's either tough or it's all gone. The knot.
差不多。
很深欸，
啊，
你扎得很深了哦，他都没有感觉。
就是穿过去的几乎，这里穿到这
He
里。
said it almost penetrated the whole hand. Now we're gonna go from this side over. This is what I mean by aggressive Chinese treatment.
有没有？
有，
这个有。
Yes. Yes, painful.
This-
Donna and I
这个-
both were treated by
这个有。
Dr. Diao for neck pain, where I felt like my
没有。
head was gonna be cut off. She said it felt so good. So, everybody's feeling is different.
啊，好了，那个动一下。
Okay, so he said now the treatment is complete. He wants the patient to feel his thumb and see how he feels. 感觉如何？手再这样动动，
看看怎么样？
这样转一转。
效果不错。
So he said the effect should be good. Let's see.
慢慢还会更好，慢慢还会更好，更好。现在他讲过不出来，他是真普在痛啊，什么痛啊，
Yeah.
都有。
So Dr. Diao is saying that, with his style of treatment, the patient might feel more pain or might feel relief. But then he cannot really, for a long time, he couldn't tell us if he feels better or not, because he's probably feeling the pain from the needling and also the pain from, his thumb. He cannot distinguish what he's
慢
feeling.
慢会很好，慢慢会更好，
So
明天就更
he,
好。
he will feel better for sure.
他一般
Tomorrow he'll feel much better.
会保持很久时间，他不会。
Okay, so this treatment is gonna last a while. So tomorrow he'll feel better, and then he'll continue to feel better. The effect will last a while.
好了，可以了。
So let's let Dr. Diao take a 10 minutes break, and we'll prepare for our second patient. Thank you.
这个痛的人啊，很多啊，几乎每天都可以碰得到啊。
对啊，大家都在玩手机，不痛才怪哦。
你学。
Recording stopped.